Do you occasionally suffer from cardiac arrhythmias? Does your heart suddenly start pumping excessively or even stumble? Then an excess of calcium may be the cause. Of course, arrhythmias can have other causes, such as emotional stress, hormonal changes, and thyroid problems. The best known, however, is an excessive level of calcium in the cells. Let's take a closer look. Excess calcium, which gets stored in your cells, is the most common cause of cardiac arrhythmias. Many drugs for arrhythmias are calcium channel blockers. But calcium is not bad in itself, as it is one of the most important electrolytes and should have its proper place in your bones. It is responsible for tightening your heart so that a contraction can occur. Whereas magnesium, another electrolyte, is the antagonist for relaxation. Cardiac arrhythmias have many and mostly simple triggers, and almost everyone is affected by them at some point in their lives. Among the best known causes are stress, i.e. the increase of cortisol, alcohol, caffeine, sugar, diabetes, insulin resistance, a low level of magnesium due to malnutrition and insufficient consumption of green vegetables containing chlorophyll, vitamin D deficiency, special chemicals in chocolate and drugs. Particularly noteworthy here are psychotropic drugs, i.e. drugs for depression, because they channel calcium directly into the cells, where it remains. All these factors affect the calcium physiology and create an imbalance in the electrolyte balance. So how can you get calcium out of your cells and into your bones? The answer is magnesium. This prevents storage. Magnesium also has the ability to keep your potassium level high and inside the cell and your sodium level low and outside the cell. In addition, 99% of magnesium should be inside the cell and only 1% outside the cell. This is why blood tests are misdiagnosed, because actual magnesium levels are not measured correctly this way. The optimal measurement would be an intracellular test. This tells more about the actual level. An important factor in keeping calcium out of the cell is vitamin K2. It is used in the areas of your heart, nervous system and joints, as well as your kidneys. Vitamin K2 carries calcium from your blood and cells back to your bones. Vitamin D3 also performs this important task. What foods are rich in K2? And what types of magnesium are there? Find out and feel free to follow me on the next episode. Thanks for tuning in.